Here's 7 tests every diabetic should have. In this video, I've rounded up top tests, and not many people know them. Or sometimes I mention it, they say, didn't even know I needed that test, no one told me. So I'm doing this video to highlight how important these tests are. There are 7, and the last one's crucial. It saves the most lives. So listen up and let me know if you're diabetic. What type? Type 1, type 2, or even pre-diabetic? Drop it in the comments. Also let me know where you're from. I'm broadcasting from Porto Alegre. All right, let's start. 7 tests. First up, eye checkups. Why? Because high blood sugar can affect your vision, your eyes. It can cause retinal damage. So it's important you get your eyes checked. And who needs this test? Those with type 2 at diagnosis, those with type 1 5 years post-diagnosis. So there's a difference. But for most, over 90% of type 2 cases at diagnosis, you should see an eye specialist. Ever had your eyes checked this way? If yes, let me know in the comments. The second must-have test is cholesterol. Why? What's the top risk? One of the top risks and deadliest, cardiovascular risk. And the cholesterol test helps your doc properly assess. Yeah, just having diabetes already adds risk of heart diseases. So must test for cholesterol. Why? Because high cholesterol contributes to heart diseases. That's a fact. There's the bad cholesterol, the LDL, and you gotta know your cholesterol levels. Then you might ask, I heard a doc say cholesterol is good for us. Why do others say it's bad? The issue is excessive cholesterol, got it? When it's too high. So remember that. Cholesterol at normal levels is needed for producing hormones and for our body function. So cholesterol's all right. Excessive cholesterol's the problem, and it's proven to increase heart disease risk. Test #3, also essential, is the urine test, specifically for microalbuminuria. Like the eyes, the kidneys can be harmed by high blood sugar levels, and one early kidney disease indicator is microalbuminuria. A lot of people get surprised, never heard of this test. Have you ever taken this test to check kidney damage from sugar, from diabetes? Let me know in the comments. Tell me if you knew or not if you took it. This test has 2 methods for checking kidney damage. The microalbuminuria test. There's the 24-hour test. It tracks protein secretion, and in some cases it can be done with a simple urine sample. Doc's got a way to figure that out. So if diabetes is harming your kidneys. So remember, microalbuminuria is important. Number 4, glycosylated hemoglobin test. Wait, what's glycosylated hemoglobin? What's that? It's simply the average blood sugar over the last 90 days. So it can calculate how your sugar control is. This test is crucial for diagnosis and is a great test for diagnosis and tracking. Why? Because it lets your doc predict your chance of diabetes complications. What's the value usually for glycosylated hemoglobin? 7. But it can change. In one video I said 7, and some people said their doc told them it was 6.5. That's also possible. I can't discuss each case here, but normally it's 7. That'd be a good result. In some cases like 6.5, the outcome can also vary. It can slightly go up, like 7.5 in some cases, or even 8. It depends on circumstances and on each patient, but 7 is a value to stay clear of chronic complications of type 2 diabetes. Some patients with kidney issues may alter the glycosylated hemoglobin test, like those with inefficient kidney function. In that case, the doc might combine it with other tests, like the fingertip blood sugar test, okay? So this test has some tricks, like with weak kidneys. And test number 5, since I mentioned kidney failure, is also vital for checking kidney function. It's the creatinine test. We've seen the urine test, which displays kidney damage, but this test, the blood creatinine test, can estimate how well your kidneys are functioning. Shows the filtration. What is the glomerular filtration rate? Diabetes is one of the primary reasons for reduced kidney function. Another major cause is high blood pressure, the 2 largest reasons. Through the creatinine test, the doctor can see if your kidneys are performing well. Number 6. This test is one many people have never had, like the microalbuminuria test. This test is done in office for diabetic neuropathy. Diabetes significantly causes decreased sensitivity in legs, for instance. And this exam is done with a monofilament. Your doctor can identify if you have diabetic neuropathy, even in early stages before you feel symptoms like numbness that affect your life quality. In some groups, diabetic neuropathy is the main chronic complication of diabetes. The most common complication is often not tested. So, test with a monofilament. How does it work? For your understanding, the monofilament is a small device the doctor uses on areas of the foot to check if the patient can feel it. Here's a photo of the monofilament. It's not a little device, it's complex, but visualizing makes it understandable. The last test I mentioned reduces mortality the most. Monitoring and controlling blood pressure, especially for cardiovascular risk, helps most. Many people have never checked their blood pressure, and I'm referring to times outside the doctor's office. Why? Often you have what's called white coat high blood pressure at the office. No joke, it happens. The patient only has high blood pressure during consultations. Nervousness increases adrenaline, cortisol, and blood pressure. A lot of people here experience this. You might too. Tell me if this happens to you. Then there's masked hypertension, where a patient has high blood pressure outside the office. During consultation, the pressure normalizes due to relaxation. Periodic blood pressure evaluation is crucial. Take a week and take 3 alternating time measurements and note them. Note both numbers, say 120/80, along with your heart rate. It helps the doctor to know if you need medication or any changes. Want more videos like this? Subscribe and activate notifications. Select all. Whenever I post a new video, YouTube will notify you. Now, here's a diabetes playlist for you to watch. If you like this video, you'll love this playlist. It gives hints on blood sugar improvement, test details, and explains symptoms. So click here. I'm sure you'd like. Take care. See you next time.